Hello and welcome to Health and Ranking Conclave, etnow.in. Today we are joined by Dr. Rajendra Prasad Ray. He is consultant urologist at Peerless Hospital. My first question to you, sir, would be, in simple words, what is laser surgery and how is it different from a normal surgery?
Actually, the terminology laser surgery is not a medical terminology. It is basically introduced by the common man or the patient itself. What happens is, in surgery, we use laser as a tool. It is not actually surgery. But it is a powerful tool and it helps us to doing surgery in a better way. But as the patients understand how it is and they introduce the term laser surgery, and we see that laser surgery is a very simple word and that speaks the volume. So we accepted the term and we also use nowadays as it is a laser surgery.
So is it safe for common problems like kidney stones and other normal problems?
In my specialty urology, we use laser in particularly two procedures. One is the prostate and another is the stone. But laser has been introduced for more than 4 or 5 decades and it has been proved in many research in studies that laser is very safe and it is used in other disciplines as well. And before being introduced into our specialty, it has been studied in non-animal model, then it is animal model, and then human trial. So before being introduced, it has been gone extensive research and investigated better way. And since in urology, it has been for last 10 years and it is very safe because laser is a powerful tool definitely, but if you use it judiciously and in a manner that is safe for the patients, and definitely it helps in doing the surgery in a minimal way and that actually giving benefit to the patients.
So how lesser is the pain in a laser surgery compared to a normal surgery?
So what happened, if you see the history of the surgery, so we usually start the surgery cutting open the abdomen and that gives a lot of pain, the tissue trauma, the morbidity was more. But as the technology advances, so we introduce the endoscope so that we can enter through our natural orifices. But for that reason, we need some tool that can cut the prostate or that can disintegrate the stone. And here the laser helps us. So minimize this instrument that reduce the tissue trauma and that helps in basically. So the pain is less, the recovery is faster. So patient can be discharged early. In stone surgery, we usually discharge in the same day. In prostate surgery, we can discharge in the next day.
Sure. Also, nutrition is something that we have to take care of as generic people, no matter the disease or no matter any health concerns. So what significance does carbohydrates have in our diet, and how important is rice, especially given it's a staple for most of us as Indians? What variety of rice would you recommend for generic Indians?
So in my specialty, the stone is basically a metabolic disorder.
Yeah.
And everybody knows that diet has a role in stone disease. But it is not the carbohydrate. Here the protein is the main culprit. As well the increased salt intake, the junk food, the drink which is available now in the packaged form, that gives a lot of salt and sugar. And that produces basically the calcium in the urine and that produces stone. Carbohydrate has very little effect on the stone disease.
Okay. Sir, also about the patient recovery with laser surgery, how fast is it compared to the other one?
So if I talk about my specialty only, so we use the laser in prostate surgery and for the stone disease. As we do the stone disease in our Peerless hospital, we have all sort of instruments that are miniaturized. And so we introduce through the natural orifice. We don't cut the abdomen, we don't cut any organ. So it is very painless and safe. In stone surgery, we can discharge the patient in the same day or the day after. In prostate surgery, in conventional surgery, there is bleeding and we need a clear urine before we can remove the catheter and discharge. It usually takes 3 to 4 days. But if we do use the laser in prostate surgery, we can discharge the next day.
So thank you so much, sir. This was very useful for us. Thank you for joining us at etnow.in Health Ranking and Conclave. Thank you so much, sir.
Thank you very much.